That darker colored hoof horn underneath is that new sole that's formed to replace this one as it's lifted away. Notice the orientation of this dot right now as I make this next cut. You're going to see that that lesion is actually up just above that, further illustrating that point that that mark we see in the sole does not necessarily point exactly to where that lesion is, but is actually a timeline showing how that defect has formed over the course of time and ultimately what has resulted in the path of that bacteria as it's traveled up through that crack and affected the corium. Our job here is to trim away any of this loose stuff so we can free that lesion. Now, just because there was a defect in this white line that took time to form doesn't mean that that cow could feel that over that time. What that white line is just a junction that kind of glues that sole and that outside wall together. So if there's a defect in there, she's not going to notice that until that defect is exposed to the outdoors and bacteria is able to travel through it and get to that corium. Then it's just simply a cosmetic flaw in that white line that isn't really causing any problems. Once it's exposed to the outside and bacteria can travel it, that's when the problems happen. And when it comes to blocks, I have a couple different options that I use. One block that's a little bit larger and one that's a little bit smaller, different thicknesses. I try to size them what's best for that particular claw. This one's a little larger, so we're going to use that block that's just a touch larger and a little bit thicker. Now that we got that block on, we can get this all cleaned up and get it its wrap. I got a comment recently saying, why don't you leave that claw wet with that chlorhexidine? Wouldn't that allow that salicylic acid to stick better? And it would. However, those two products will create a chemical reaction when they get mixed, and it diminishes their effectiveness, both of them.